Hospitals under pressure as coronavirus cases rise. Hospitals in the south of England say they have seen a real rise in pressure as the number of COVID patients needing treatment increases. The service and at least 2 others have urged people to call 999 only if there is a serious emergency. Dr. Katherine Henderson, from the Royal College of Emergency Medicine, said she experienced wall-to-wall COVID while working at a hospital in London. Professor Jackie Taylor, president of the Royal College of Physicians and Surgeons of Glasgow, said the issues faced by hospitals in southern England were similar to those experienced in Scotland in October and November. But the true scale will be higher, as Scotland is not releasing data around deaths between 24 and 28 December, while Northern Ireland is not providing either case or death data. There were 21,286 people in hospital with coronavirus across the UK on December 22, the last day for which data is available, according to official government figures. The BBC has been told the London Ambulance Service, LAS, received as many emergency calls on 26 December as it did at the height of the first wave of COVID-19. An LAS memo said the rising demand was down to the rapid spread of the new variant of the COVID-19 virus. Figures seen by the BBC show at one London hospital on Sunday morning, ambulance crews were typically waiting nearly 6 hours to hand over patients to staff. One paramedic told the BBC that some patients had been treated in ambulance bays because of a shortage of beds and staff were finding the whole situation very stressful. LAS said demand had been rising sharply in the past weeks, while similar pressures are also being reported in other parts of southern England. The South Central Ambulance Service, which covers Berkshire, Buckinghamshire, Oxfordshire and Hampshire, asked people only to dial 999 in a life-threatening or serious emergency. And the South East Coast Ambulance Service, covering Kent, Surrey and Sussex, has asked the public to consider other options before calling 999. Speaking to the BBC on Sunday, Saffron Cordery, Deputy Chief Executive of NHS Providers, which represents hospital trusts in England, many more people were coming into hospitals with COVID, as well as other conditions. The public should be under no illusions that this is one of the most challenging times for the NHS, she said. Mainland Scotland entered Level 4 restrictions from Saturday for 3 weeks, and a similar stay-at-home order is also in place in Wales. Infection rates in England are currently highest in areas of Essex, London and other parts of the southeast. Parts of Essex have recorded the highest weekly coronavirus case rates since the pandemic began. In the week leading up to 21st December, Brentwood, Epping Forest and Thurrock all had rates of more than 1,350 cases per 100,000 people. It comes as 24 million people, or 43% of England's population, are now living under the harshest Tier 4 rules after more than 6 million people in East and South East England went into the highest level of restrictions on Saturday. Meanwhile, NHS England said coronavirus vaccinations had been paused on Christmas Day and over the weekend but would resume on Monday. Professor Andrew Pollard, the chief investigator of the vaccine developed by the University of Oxford and AstraZeneca, said they were hoping regulators would soon give their approval for its use.